The World Health Organization confirms that Delta is now the dominant COVID-19 variant in the country. New COVID-19 cases could breach the 25,000 mark next week, according to the OCTA research group. Domestic and foreign borrowings have jacked up the government's outstanding debt to 11.6 trillion pesos as of July. Senator Bongo says he is ready for a possible Senate inquiry into his alleged role in the suspicious government purchase of overpriced medical supplies. In sports, the PBA is all set for the resumption of the Philippine Cup in Pampanga tomorrow. Fast, focused, and fearless. Here's a roundup of stories we're watching now. I'm Sean Yao. No less than the World Health Organization has confirmed that the more transmissible Delta variant has been driving the surge in COVID-19 cases across the country. Greg Gregorio with a report.
The World Health Organization has confirmed that Delta is now the dominant SARS-CoV-2 variant in the Philippines. WHO Country Representative Dr. Rabindra Bayasinghe also notes that there is now a community transmission of the highly infectious variant across the country.
Certainly, based on the limited sequencing data that we have, that is confirmed. Nearly 70% of the last sequencing run was attributed to Delta.
The Health Department notes that cases of the Delta variant went up from 6% in June to 56% this August. Undersecretary Maria Rosario Vergeres says that Delta was detected in 7 out of 10 samples from the latest batch that underwent genome sequencing.
Well, ang Delta variant, no, base sa ebidensya, sinasabi ang isang taong may sakit na COVID-19 at variant niya ay Delta, siya ay maaaring makapanghawa mula 5 hanggang 8 tao. Kaya pag tinignan natin ngayon ang pagtaas ng kaso, napakabilis because exponential ang kanyang increase.
With this, the WHO is urging local officials to come up with ways to minimize the impact of the Delta outbreak.
What we need to do is to see how best we can support the Philippines, manage this situation, how best we can minimize the public health and economic impact of this new surge of cases, which is largely driven by the Delta variant.
The heads up from the WHO comes just one day after the country hit another record high of new COVID-19 cases at over 22,300. In an interview with One News Now, the OCTA research group warns that new infections could even breach the grim milestone of 25,000 by next week.
It's probably not going to hit 25,000 this week, but we will have to reevaluate if there's a chance that we'll hit 25,000 next week.
The Health Department says that COVID-19 figures may increase further by the middle of September.
Looking at the case increase we experienced last March to April, the highest peak was observed on the 6th week after cases started to increase at the end of February. If the same pattern will occur this time around, we may see cases peak mid-September.
The agency explains that despite the continuous efforts of LGUs to immediately identify and isolate cases, the presence of COVID-19 variants is still driving surges. OCTA is once again sounding the alarm on the healthcare capacity in some regions, particularly in Metro Manila.
Could be on the verge of collapse. We're seeing, even though the numbers are not yet record high in the NCR, we're actually already seeing record high numbers in terms of ICU occupancy and hospital bed occupancy.
For its part, the DOH once again highlights the need to ramp up vaccinations to lessen hospitalization risks among COVID-19 patients.
Look at what's happening in the National Capital Region. Example lang po yan, mataas po ang pagbabakuna sa NCR at nakikita natin unang-una yung projected na 83,000 active cases projected for NCR by the end of August 30. Hindi po natin narating yan. We're just 41,000 cases here in NCR. are currently active cases. So ibig sabihin, we are doing something good.
Vergere is calling on those who have been fully vaccinated against COVID-19 not to get booster shots.
Pero sana isipin nyo, yung bakunang itinurok sa inyo na pangatlong beses nyong nakuha, ninakaw nyo ang bakuna para sa ibang tao na dapat sila ang meron at maaring ikamatay nila to.
The WHO echoes this, saying that the Philippines will still need to wait for the availability of second-generation vaccines before booster shots can be explored. For News 5, Greg Gregorio, we are One News.
The Health Department has reported over 13,800 new COVID-19 cases on Tuesday. This has brought our total caseload closer to the 2 million mark. There are still 145,000 active infections across the country. The DOH also confirmed 118 new deaths today, pushing the death toll to over 33,400. 37 cases that were previously tagged as recovered have been reclassified as deaths. On the flip side, 16,700 new recoveries were logged in the last 24 hours. Out of 49,100 COVID-19 tests conducted for today's bulletin, 25.4% rendered positive results. And nearly 33.1 million COVID-19 vaccine doses have been administered across the country. Some 19.3 million jabs were given as first doses, while 13.7 million were administered as final doses. Presidential Advisor for Entrepreneurship, Joey Concepcion, has proposed a bakuna bubble setup in Metro Manila to help businesses bounce back from their losses. However, WHO Country Representative Dr. Rabindra Abeyasinghek said that vaccine bubbles do not guarantee the prevention of COVID-19 transmission among vaccinated people. Abeyasinghek also cited cases of breakthrough infections and even deaths among those who are fully inoculated.
Actually, the concept of bubbles for vaccinated people doesn't actually hold true because you will continue to be at risk of getting infected. And if you are infected, you could infect other people.
Researchers from the University of Pennsylvania discovered that our immune systems have a backup plan once COVID-19 antibodies begin to decline over time. Let's find out more from this Bloomberg Quick Take.
Our subjects still had detectable antibodies at 6 months. So, antibodies are not gone at 6 months, but they are declining. On the other hand, memory B cells were actually increasing over the 6 months that we monitored. That was maybe a little bit surprising. Those memory B cells also were quite good and actually got better over time in their ability to bind to variants, including the South African or Beta variant and the Delta variant. So we're getting increased coverage of the variants, at least with our memory B cell compartment. The idea there is that you have this sort of reserve capacity that the immune system has a backup plan, and should antibodies wane and you get a little bit of local infection, you have memory B cells there to really sort of renew or sort of respond very rapidly and make new neutralizing antibodies. We're seeing a drop in efficacy when you only measure whether people get infected, but really, really steady immunity if you're measuring severe disease outcomes.
pause for a quick break, but we will be back with more stories after that. Keep it here. You're still watching One News Now. I'm Sean Yao. Senator Bongo has vowed to participate in a possible Senate inquiry into the government's purchase of overpriced medical items. In a privileged speech, Go stressed yet again that former Budget Undersecretary Lloyd Christopher Lau did not report to him. Lau was the head of the DBM's procurement service when the anomalous contract was awarded to Pharmaly Pharmaceuticals Corporation. Addressing President Duterte, the senator said he will resign if his involvement in the controversial pandemic purchase is proven.
Handa po akong magpaimbestiga. Wala po akong tinatago. Wala po akong kinakatakutan. Mas mabuting malaman ng tao ang katotohanan para matapos na rin po ang haka-haka mula dyan kay Lau na yan.
Senate Blue Ribbon Committee Chair Richard Gordon earlier said the investigation may involve Senator Go and even President Duterte. This is after footage of the two officials meeting with Pharmaly executives back in 2017 was brought to light. Gordon also said that Senator Go should have at least defended the senators from President Duterte's tirades early on.
Bakit hindi mo dinefend yung Senado sa Presidente? Diba dapat sabihin niya, Mr. President, Senador ako dyan, nagagalit yung mga kasama ko. Mr. President, hindi naman niyo dapat atakein yung Senado.
And the PBA Philippine Cup is back in action tomorrow at Bacolor, Pampanga. This is after all participants returned negative RT-PCR test results. The tournament will resume in a semi-bubble format where teams' movements will only be limited to their hotel and game venues. All teams will be undergoing mandatory swab tests on Mondays, while antigen tests will be conducted on all game days. Commissioner Willie Marshall said the season will be halted again if 6 teams return positive results. The undefeated TNT Tropang Giga will be facing off against the winless Blackwater Bossing to headline the triple header on Wednesday. At 3 p.m., Terra Firma Jeep takes on the San Miguel Beermen, while Meralco battles Magnolia at 6 p.m. The games will be played at the Don Honorio Ventura State University Gym. Let's now take a quick look at today's other top stories. The country's outstanding debt hit a new record high of 11.6 trillion pesos as of July. Data from the Bureau of Treasury show that domestic and foreign borrowings plus a weaker peso further jacked up the government debt. And on One News' The Chiefs, Senator Richard Gordon said that President Duterte may be held liable for the purchase of overpriced medical items. Gordon presented footage footage from a meeting attended by President Duterte and the president of Pharmally Pharmaceuticals Corporation. The local firm bagged over 8 billion pesos worth of deals with the Budget Department's procurement service, even without prior bidding records. In Afghanistan, Taliban fighters celebrated the takeover of the Kabul airport from American forces with gunfire that echoed across the capital. This is on the back of the U.S. withdrawing the last of its troops, marking the end of 20 years of war that took thousands of lives and cost trillions of dollars. For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Masks on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.